What's going on, Barbell Nation? Just launched a new article over at thebarbellphysio.com talking about fixing the butt wink during squats. What do we mean when we talk about butt wink? Well, the butt wink refers to the excessive flexion of the lumbar spine that some athletes demonstrate when they go into a squat. Now, before we dive deeper into that, let's distinguish butt wink from not having a butt wink. So when you go deep into the squat, my wife's laughing because I'm saying butt a lot right now, so I apologize if y'all hear her. When we squat, everybody's lumbar spine does go through a little bit of flexion. Butt wink refers to excessive lumbar flexion. It's not really possible for people to keep a completely neutral spine. A lot of people say that going into the butt wink position is really bad, and that's not exactly clear in the research. But from my perspective, if we have the option to keep the back in a more neutral position or let it really round and cave like we discussed with the butt wink, I'm going to choose to stay more neutral. I think that's going to let us have a better transmission of force through the legs, the hips, through the spine, and into the barbell if we're doing a loaded squat variation. So again, butt wink is just this excessive flexion of the lumbar spine, excessive posterior rotation of the pelvis as somebody squats down. Now, a lot of times when people demonstrate this butt wink movement fault, coaches and athletes immediately jump to that there's a mobility limitation. And that's not always the case. In fact, a lot of times we'll find people with great mobility still have butt wink. And so for them, instead of it being an issue of needing to stretch something or mobilize a joint, they need to get better motor control. So this article, which again you can find on the barbellphysio.com, is all about how do you figure out what the exact pinpoint thing that you or your athletes need to work on is. So we go through like a three-step process. Step number one is you've got to watch the squat, and you've got to determine based on that where to start. A lot of athletes are going to start in a little bit of an overextended position where their lumbar spine is actually an extension, their pelvis is anteriorly rotated. So if their pelvis is anteriorly rotated, then their hip sockets are going to face downward a little bit. That's going to make it so that as they go deeper into the squat, they're going to run out of room inside the hip socket to go deeper into hip flexion. And so if an athlete is starting overextended, then the only choice they're going to have if they want to hit appropriate squat depth is they're going to have to go into that butt wink pattern. So we need to determine, do we start neutral and then move into excessive rounding, or a lot of athletes start overextended and then they look like they butt wink, but really they just move to a more neutral position. Let me show you what I mean with those two things. So this isn't going to be the best because it's sometimes hard to demonstrate these faults when you don't have them, but let's take an athlete first that starts overextended. So right now my lumbar spine is extended, my pelvis is anteriorly rotated. As I squat down, I'm eventually going to run out of room in my hip socket. My hips are getting really pinchy right there, so if I was being forced to squat lower, the only choice I had is to now round. And that might look like the athlete's going into a butt wink, but it could be, again, that they're just going from an extended position to a more neutral position. The other thing we'll see is we'll see people that start in a good position, and then as they squat down, they go into that lumbar flex position. But if you don't know where they're starting, you can get off on some crazy tangents, and you need to know right away, is it the way that they move, or up next we got to talk mobility. So if we're looking at mobility, the two most common places are of course the ankle or the hip. And it's not always where you feel tight. We see athletes all the time that have great hip mobility, but when they squat, they feel like their hips are tight, but when I actually get my hands on them, move the hips around, their hip mobility is good. Or have athletes that feel like their ankles are tight, but when I test out their ankles, they're not. And so you really got to do a good job of testing out which area it is. Up here, I've got some pretty poor diagrams of this, but the athlete on the left has a little bit better ankle mobility. And so the barbell, for it to stay over the middle of the foot, they don't have to go into as deep of hip flexion as the athlete on the right who has a little less ankle dorsiflexion. Supposedly, this diagram again is pretty crappy. So this person here is probably going to feel like they've got really tight hips. But as you can see here, this angle here versus here This one, if I was a better artist, would be noticeably greater degree of hip flexion. So even though they feel like they're tight here on the hips, it could be that it's actually an ankle issue. And I see that all the time, even in some athletes that feel like they have tight shoulders. If we're talking Olympic weightlifters and CrossFitters, I've seen this so many times where they feel like they have tight shoulders. Their shoulders are great, but really it's when they get into the bottom of the snatch or an overhead squat, their ankles are so bad that their shoulders have to make up for a ton of range of motion. So taking a really good systematic viewpoint of your mobility and not just going with what feels tight is going to get you a lot further. So we need to break out ankles, we need to break out hips. We also want to talk, and this is all again covered in the article on the barbellphysio.com, hip scour test is something that I'll use a lot of times. And sometimes we'll find that athletes just truly lack the hip socket mobility to squat, quote, ass to the grass. And so sometimes athletes just need to realize what their anatomy will let them squat to currently. So after we've watched the squat, analyzed mobility, if we've cleared them of mobility limitations and we know that they're starting in a good position, then we really know that we've kind of narrowed it down to more of a motor control aspect. That it's not that we need to stretch or mobilize anything, we just got to teach the athlete how to move better. And I give you a series of exercises to start with in that article that you can check out on the barbellphysio.com. This week I just relaunched my video, Master the Squat. Now comes with a full ebook to give you even more resources, easier way to learn how I break down the squat, how I test the different joints, and how I correct squat movement patterns. So that just relaunched this week, and this week only, I'm offering a free Olympic weightlifting mobility warm-up. It's a 2-day program. If you're an Olympic weightlifter or CrossFitter, it's what you need to do to get moving better before you clean and jerk and snatch. Any questions? All right. Thanks for watching, guys. Again, check the article out over in the barbellphysio.com in the blog. Have a good night.